Hello, my name is Kim Brown. Today we'll be reviewing the lesson plan for how to place a patient in the KED or the Kendrick Extrication Device. The primary goal of this lesson is to teach the technique for placing a patient in the KED or the Kendrick Extrication Device and to secure that patient to a long spine board. The cognitive objections of this lesson are as follows. At the conclusion of the lesson, the student should be able to, number one, list the equipment needed to place a patient in a KED or the Kendrick Extrication Device and secure that patient to a long spine board. Number two, the student should be able to define the following components of the Kendrick Extrication Device: the cervical collar, the KED, the chin straps, the leg and waist straps, padding, and long spine board straps. The psychomotor objectives of this lesson. At the conclusion of the lesson, the student should be able to demonstrate, number one, how to take control of the cervical spine. Number two, placing the patient in the Kendrick Extrication Device. And number three, securing the patient to the long spine board. The effective objective of this lesson. At the conclusion of this lesson, the student should be able to, number one, explain the control of spinal movement and the negative outcomes if not properly maintained. And then the recommended list of equipment should be familiar to the student because this will be needed for this lesson. The AV projection equipment, the cervical collar, the long spine board with straps, the Kendrick Extrication Device, the personnel to assist with spinal immobilization of the patient. The schedule will be as follows. From 8 a.m. to 8:45, there will be a video presentation on technique for placing a patient in a Kendrick Extrication Device. At 8:45 to 9 a.m., there will be a break. At 9 a.m. to 9:30 a.m., there will be a lecture on securing the patient in a Kendrick Extrication Device to a long spine board. At 9:30 a.m. to 9:45 a.m., we will go on break. At 9:45 a.m. to 12 noon, we will have a skills practice station. At 12 to 1 p.m., we will go to lunch. At 1 p.m. to 2 p.m., we will have another skills practice station. At 2 p.m. to 2:15, we'll have another break. At 2:15 to 4 p.m., we will do the skills evaluation. A skills demonstration on placing a person in the Kendrick Extrication Device will be demonstrated at the end of the lecture and will be completed by each student.